Good morning. So now that we have our technical difficulties out of the way, we can probably get going there. So I wanted to talk about this approach that that I've used for over 15 years in the addiction recovery in Northeastern Ohio. We heard yesterday about the idea of using a tripod or a three-legged stool, because we take in mind that when we are dealing with just about anything that deals to do with our human being, we have to take in consideration body, mind, emotion, and spirit. This is no different than when we do it in anything, in any aspect of our life. And addiction recovery, this plays a more solid role. And of course, one of the other tripods that is fundamental in the early days of recovery is to take into considerations the nutrition, exercise, sleep, because all those things need to be balanced. Like any other tripod, if any of these legs is a little shorter or a little longer, you're going to fall off. So we have to keep everything in balance. We have to keep everything in harmony. I started doing addiction recovery per se over 12, 15 years ago, almost now, in a center in Ohio. And the reason being is because I started seeing that what was happening, people were going through a medical detox, they come back on the street, a few months later, they relapse. So they were back in detox, so they ended up going to jail. And then the merry-go-round went on and on for the longest time. So obviously, there is something that we need to change in the formula before we can get different results. The program is a nutritional assisted treatment that I call MAT. And we take into consideration the fact that often we hear people saying addiction is really a lack of will. Really, it's not, because it is a disease of the brain. And until you fix the brain and you give the brain what it needs, you are not going to go ahead and go any further. So we look at it from the three-legged stool, the tripod, as a bio, psycho, social, and spiritual imbalance. In order to get to the path to recovery, we must address all of these individuals' issues. So the biochemical, it is to do, of course, with the nutrition, the physiological imbalance, the diet, the medications and supplements, the sleep, the good exercise, because again, all those things need to be balanced. The psychological has to do with therapy, because obviously we want to be able to have counseling for these people. And neurofeedback, CBT, cognitive behavioral therapy, EMDR, those are all things that have become very helpful in maintaining the health and the balance on the psychic state. And of course, let's not forget the social aspect, the connections with their group, and the spirituality, because again, we all need to work and recognize that maybe when they are into the phase of recovery and they feel helpless, they need to have some sort of higher help connections, because at that point they really have lost all the connectivity with themselves, with their family, with their workers, and that's the other aspect that becomes very important. So addictions, we can say that we all have a little bit of addictions in one way or the other. We like our coffee or a cigarette or a chocolate, depending on what is that we like to sip for most of the time. But what makes it a true addiction is when the behavior becomes compulsive and becomes uncontrollable. So with a longer period of time that this goes on, it's going to change the brain and the pathways in the brain. So it's going to affect not only the brain, but the behavior of the individual. This is just one of the statistics, and this is why this topic has become really prevalent and dear. Because past couple of years, it has cost the United States $1.85 trillion, 578 million in economic loss, and 878 billion in society harm through quality of life adjustment, premature loss of life. There is not one day that someone doesn't make the paper that they have OD, from overdose. So this is costing, obviously, the nation and the taxpayers and the society a lot of money, but pain and aggravations, of course. But this is the breakdown on how the money goes from the healthcare, the productivity, and to all the other public assistance. Now, one of the things, and we have heard about this yesterday too, when we have had speakers talking about Ayurveda and talking about meditations. When I look at diet, I look at more than just the food that we eat. And in my opinion, when we look at diet is also things that we watch, things that we listen to, things that we read, the people you hang around. Any of those things, in one way or another, will have an effect on your health. If you hang out with the wrong people and have wrong energy, you're going to end up falling into the health. If you watch or read things that are not in resonance with your path to recovery, you're going to end up, having more than just a few months worth of recovery. So it's going to take long because everything is a vibration, everything is energy. So whether it's a word or a movie or a song or something you read, it's going to vibrate with us in one way or the other. And this is really very, very important, especially on the early stage of recovery, because we already are walking on thin ice. So we want to make sure that whatever we do, not only from getting good nutrition, but also surround ourselves with people that will support us. Surround ourselves and watch, read things that resonate in a positive aspect and make the connections with us. Of course, the first major issues with the addiction people is that substance abuse is going to lead to poor nutrition. I have yet to meet someone who's been in recovery and has gone through a period of addiction, whether it's from alcohol or drugs, or in the past decade, social media has also become a major thing for addictions. I see young kids that they don't sleep, they don't eat, so they're going to start becoming deficient on the macro and the micronutrients. So of course we know that when these things started to happen in our body, there's going to be other symptoms that's going to lead to depressions, to anxiety, and those are usually good trigger to continue the behavior or to trigger a relapse for people that are just in the early stage. So it's imperative that we do maintain healthy and balanced nutrition, because that's going to help feeding the brain, that's going to help improve our moods, it's going to help improving our health. And of course, if we are healthy and we're feeling better, our brain is going to reward with healthy behavior. We are more likely to exercise, we're more likely to continue feeling better. I have not met anyone that gets up in the morning and says, well, I hope I'm going to feel bad and have a really bad day or a depressing day. I mean, we all wanted to show up and do our best, but when there are physical and psychological imbalance, it becomes a difficult task to go ahead and do our best. Many newly sober individuals, like I mentioned, suffer from nutrition deficiency, which of course it's going to interfere with the mental and physical health. And in order to provide a balance, one of the first things that we want to do is identify those deficiency and started to supplement it with good nutrition and supplements. And of course, a lot of times, because by the time I get them in my office, like I say, they're either out of a jail or out of a detox center. They are really big in deficiency of different vitamins, different amino acids. So it becomes the first stage to start balancing those things. We know that by the time they have used and been using alcohol and other drugs, this is also going to have an impact on the digestive tract as well as the other organs, livers, kidneys, which they're saying conditions that get affected because of different drugs and substances that they've used. Of course, the more prolonged this goes on, the more deficient and the more malnutrition is going to happen into their system. We also know that alcohol it blocks the absorptions of some of the key nutrients, then it's also going to create deficiency. So now it becomes a catch-22 where if you don't eat properly, you are going to become deficient, and the more deficient you are, the more you are not going to feel good enough to go shopping, cook a healthy meal, go to the gym and exercise. So there is this merry-go-round that goes on and on and on. We also know that it's also going to cause oxidative stress, as we see with abusers of meth or alcohol, even things like nicotine. It's going to lead to tissue damage and especially in depletions of vitamin C. So what can we say? We can say that once we start working and feeding the brain what it needs, we know that a healthy brain, it's going to give us a healthy body. That's almost a common sense things that often gets mislooked at. And it all needs to do with the level of neurotransmitters, what we're feeding and how we're feeding the brain. When I first come out of the recovery phase, often food is used as another drug or another substitute for their, just to satisfy their cravings. And one of the food that I usually see, like 99% that gets substituted and abused, is sugar. Sugar is highly addictive. We have more than an epidemic, I think probably all over the world now. It started so in the United States because it's pretty much in every food that we use. Excuse me. It's inexpensive. What's even worse than sugar is things like high fructose corn syrup, which is even cheaper and more of a junk. And the interesting things on the brain physiological part, it stimulates the same dopamine receptors that the drugs would have done. You can see it from this PET scan, how sugar, cocaine are easily related because they get on the same receptors. So again, it's with the difference that they might get off the cocaine after the detox and they start picking up the sugar. They've replaced one drugs for another. One might be illegal and more expensive. The other, it's easily available and in everything that they eat and drink. So this is where we start really focusing on making sure that the nutrition, what they're going to ingest, is enough for the protein and good fat, so the brain is not starving and is not seeking for what I call the SAD, the standard American diet. It's nothing else but ultra processed food, things that really don't carry any good energy. There is nothing fresh and energetic by eating, those kind of foods and consuming those kind of beverage. And unfortunately, what used to be the standard American diet is now becoming more prevalent in other part of the country, in other part of the world as well. So it's almost that the McDonald's and the Kentucky Fried Chicken and all the other fast food have come in Europe and other part of the country as well. You know that when they were using whatever substance they were using, it has an effect on the brain, and it has an effect on the body, but there are recommended things that we can do. Opiates, for example, codeine, oxycodone, heroin, morphines, it's going to have an effect on the GI tract, usually with constipations, intestinal inflammations. During the withdrawal, we see a lot of the nausea, we see a lot of the diarrhea. So we want to make sure that we get enough of the electrolytes. We're replacing those electrolytes that are lost during the nausea and the diarrhea. So supplements with B12, give them some energy, the B9, calcium, iron, because those are all things that become deficient with those opiates and with those symptoms. Now, some of the alcohol is going to cause issues with liver and pancreas. So we want to make sure that we supplement and support those organs. We support by a good complex of B, fatty acids, lecithin, glutamine, chromium, which also helps balance the glucose in their blood. Stimulants like crack, cocaine, and meth. Those usually decrease the appetite. So we see a lot of digestive issues there too. We see a lot of the weight loss, anorexia. We see a lot with insomnia, paranoia, dental issues, especially with American users. They always show up with a deficiency in all the B complex, as well as zinc, A, C. Those are things that we want to get with the diet, obviously, because I still think that food is still the best medicine. But when they are so deficient, diet alone may not do it at first, because we need to supplement in order to bring those levels up. On the other hand, things like marijuana, which increase the appetite, we see those people being overweight, often with an increased heart rate, which impairs the attentions, the memory, the judgment. All those things are also going to make it almost impossible for them to exercise and get some movement. And again, we need to start a regimen of, if anything else, just go walking every day, doing something easy, and start with a low caloric diet, but getting enough of the protein and supplementing with the B's, the chromium, and the C's. So, but we also know that it isn't just the illegal substance that they've used. We also know that often prescriptions that are on will cause a depletions in some of these minerals and some of these vitamins. For example, the SSRI are known to deplete the B's, B1, B2, B6, the folic acids, selenium, sodium, zinc, glutathione. We all know that when we start becoming deficient in those particular minerals, some of the other symptoms are going to start showing up. Our immune system gets lower. Level of selenium, which also helps the thyroid. So now we're going to start seeing other effects on other organs and other different part of the body, just because of prescription drugs that they may be getting it as a prescription, so they might not be getting from the street. Nutrient is well known from a lot of times. That is also known as the poor man crack, because it's one of those things that becomes another addictions. People on the Lutrin, as well as some of the other Seroquel, all those things that are usually, and I'm not saying that these mats are not needed. In early phase, this might be a good way to get them off. I'm saying is that we need to have a plan. We need to have a target where we can eventually get off of this and get them more on the natural, non-prescriptions supplements. Because otherwise, all we have done is replace one addictions with the other, and all we've done is going from, instead of getting our stuff on the streets, we get it from our doctors and from our prescriptions. So, despite the popular belief that we often hear that it's all about willpower, and we hear this a lot of times, even with people that wanted to stop smoking. Well, you can do it if you want to, just put your mind to it. It is more than that, because there is an imbalance, as I was mentioning, in the brain, that it's going to cause those cravings, it's going to cause those people to make it impossible to say no. We also know that different drugs affect the brain differently, but one thing is common, is they're all going to release the chemical of dopamine in the brain. So all they're doing is they become dopamine deficient, and they want to seek their rewards from, like I say, from food or from social media, from sugar. So is recovery possible? And I will tell you that once you start incorporating an holistic program where you take in consideration mind, body, emotion, spirit, yes, it is possible. You can see it from the past scan, how the brain of a healthy person, of an abuser, that it's been on abstinence for 1 month, and after 14 months, how they start getting back. And you can fix the brain. You can go back and lead a normal life again, and having the possibility of having that brain giving you the reward that you were meant to be given without starting your drugs again. And this is because we have this greater ability to heal in our system, that it's so much greater than anyone has ever permitted you to believe. Often this becomes an issue because when you go see a counselor or even family, sometimes worse culprits, when they all start saying, well, you're never going to get well, once you are a drug addict, you're always a drug addict, you're never going to have a normal life. And again, words, pictures, people wearing around, they carry vibrations, they carry energy. So when someone is already on the edge, the last thing we want to do is to give them some negative feedback where they're really going to feel like they can never be well. But in spite of all that, our body has this innate intelligence that it wants to get better. We cut ourselves and we see that it gets fixed. And if we don't do anything, the blood will start to coagulate. And before we know, there is a scar, and then the scar goes away. So we have that, but a lot of times we forget. One of the things that have been shown, and I've seen this in my center, is that one of the bigger trigger of relapsing for all the addiction is missing a meal, especially a meal that has good protein, and we are, again, not feeding the brain. That has a major, major impact. What I do, I often ask when I start seeing people that relapse, what they have eaten in the past 24, 48 hours. and you can see that it lacks the nutrients. So again, you get those cravings from the brain. You start getting periods of hypoglycemic where the sugar starts dropping, and you feel that you have to have something just to feel better again. So the rule of thumb is eat protein every 4 hours to help prevent relapse. One of the major reasons for that is because protein is one of the 3 macronutrients that our body does not store. Lipids and carbs, if they are no used or burnt, we know we store them. Protein do not. So they go to the foundation, they go to the muscles and everything else, and they get discarded. So we want to make sure that we always supply our body with a good source of protein. And again, it doesn't have to be, a big piece of meat, but sometimes as a snack, you offer them hard-boiled eggs. Couple of eggs is a good source of protein for that meal, just enough of the nutrients or the lecithin, just so you can support the brain until the next meal. So, and that is because, again, we want to support the brain because upstairs in our brain, we have a full pharmacy. Under normal circumstances, we make natural painkillers, our endorphins and caffeinates. We make our emotional relaxants, the serotonin. We make our natural Valium from the brain, the GABA. We make our own catecholamines. Our cats are made by, the dopamine, the excitatory norepinephrine. So when the brain is functioning well, all those things are made in the proper balance. When it's not, or when we get some of those imposters, this is where we start having issues where we get, instead of having our own brain producing our own natural painkiller, we get it from alcohol, we get it from morphine, heroin. Instead of getting our own emotional relaxant, we get it from all those SSRIs. So once those substances and those drugs get into the system and those receptors are fueled, our brain feels like it doesn't need to make it because I'm already getting it from something else. I'm getting from the alcohol, so I don't need to make my own endorphins. Again, those are things that we see over and over again. And it's not that benzo are bad, they have their functions, but it should be short-term, it should not be for the rest of our life. So we need to have a plan where we can eventually wean these people off of these drugs and do more of an holistic approach. A study that was published in the American Psychological Association found that our majority of serotonin is produced in the gut. So, we can imagine why Hippocrates thousands of years ago said all disease starts in the gut. Well, if your gut is not working properly, you are not making enough serotonin. And if you are not making enough serotonin, you are not making enough of your own emotional relaxant. So you're more likely to have anxiety, to have depression. So we want to make sure that the gut gets supported by eating good fermented food, by having good probiotics, by supporting the digestive tract. There is an estimate of 100 trillion microbes of bacteria in your gut. That's 100 trillion, it's almost more than all the stars in the universe. So we want to make sure that we support the good bacteria. Because at the end, there is this GBA, this gut-brain axis, how the gut affects the brain and how the brain gets affected by the gut. So it's one of those things that we want to make sure it's always in balance. One of the tools that I use, it's a form that looks at the various deficiency when I first see someone for the first time. And I have them fill in this particular form on a rate from 0 to 10, 0 meaning never, 10 means all the time. So you can see that there are depressions, low self-esteem, so that's seeing 9 and 10s way, and I started seeing that they were either taking some of the substance or they were just off some of the substance. Then I know that they are really low on the serotonin. So one of the things that I look at is trying to get a serotonin support, probiotics, again, to support the gut, like we talked about it, that's where we make the majority of our serotonin. Tryptophan, it's one of those amino acids that also helps. 5-HTP, in case the melatonin, especially if tryptophan is not working during the evening, because usually these people will come in with issues of insomnia, because after a long period of drug abuse, again, insomnia, nutrition, it also things that are getting highlighted first. So the other things that I look for is what is the blood level like? These people are the same. Do they get irritable after they miss a meal, after I'm not eating for the past few hours? And that's one of the things when they start getting irritable, shaky, headache. It's easy to grab some other substance that will bring you back rather than doing something to control the brain to function well. And glutamine is one of those things that I've seen that works really well. I often open up the capsules for that and just ask them to put it under their tongue. And you can start seeing the craving within 10-15 minutes, just getting rebalanced and getting ready. So again, we can do these things without going to and rely on prescription drugs. Of course, with glutamine, we wanted to make sure that they are not diagnosed as bipolar, because it could trigger many of these people. The endorphin, again, this is the other part of the form. It's a four parts form. When I look at this, I start seeing a lot of 9s and 10s when they're sensitive to emotional pain. They cry, tear up easily. Well, they're low in endorphin. Rather than supplementing with sweets and alcohol or other things that they're doing. And I don't know how it is in Europe, but kratom is now becoming a big issue in the States, where they start smoking, vaping, and it's also one of those things that can become highly addictive and often is used as a supplement for other drugs as well, or abused, or also been used. So the DL, phenylalanine, and the DOPA, as well as the DPA, especially the DPA is great when they come in and they're low on those endorphins, but also show up with pains, arthritic joints, seeing a lot of great results with the phenylalanine. GABA. When I see high scores on these reports that they are unable to relax, unable to sleep, they crave food as a way of releasing their stress. So that tells me that these people are really inefficient in GABA. Given the GABA, anywhere between 100 to 500 milligrams, 1 to 3 times a day. We want to, and you can actually see them coming down, even with kids that are on ADD. Sometimes just give it a little bit of GABA, as you can see, slowing down a little bit. The cats, the catecholamine, high scores on these, tyrosine, phenylalanine are good for these people to bring them back up, especially sometimes when you start seeing in the afternoon that they're really low and they start getting and falling asleep, they're not responding well. The tyrosine is a great thing. Of course, you want to make sure that they're not hypertension meds, because this will accelerate it. And always consult to make sure that whatever you're doing is in accordance with their drugs and with their GPs. Some of the homeopathic remedies that I've used, of course, these are not constitutional, but these are good remedies to start using in a quick way when you start seeing cravings. Lux vomica, avena sativa, arsenicum, especially during the detox. Natural Briadicum is great for depressions in alcohol and griefs. So again, these are good things. Taking a holistic approach, we wanted to make sure that we incorporate these things. Bach flower essence, for those of you that have used Bach flower or are familiar with the Bach flower, acrimony, those that usually use the drugs to avoid their true feelings. Aspen, chestnut bud, clematis. These are good Bach remedies that usually have helped the patient in the recovery. Breathing. This is one of those easy things that we all have. Doesn't require prescriptions. We have to do it in order to survive, but it's often overlooked because we usually have shallow breath instead of breathing truly from the diaphragm. When we do that and we incorporate and we put more air into the lower lobes and in the lungs, and we can actually slow down our breath by having the exhalation longer than inhalation, then engage the parasympathetic part in the nervous system, which helps us relax. Meditations. We have heard a lot of good things already yesterday by great speakers about meditations. On the average, we have about 60 to 80,000 thoughts per day in our brain. So you can imagine our monkey brain being all over. 80% of those are negative thoughts. You probably have noticed yourself, you don't overthink all the positive things, it's always something negative. And 95% of that are repetitive. You keep playing the same tape, you keep going on and on the same thoughts. I think along with meditation, prayer is the other aspect. They're going to have a strong impact on the brain and on the healing part, especially depending on the person. Inner spiritual awareness. It doesn't have to be to a particular God, it has to apply yourself to something that you recognize as something bigger than you that you can connect. With addictions, we see that connection is a major thing. In fact, Dr. Gabor Mate mentions that the antidote to addictions is connections. So we need to make connection physically with our peers, with our family, but also with our higher self. Yoga, exercise, those are great, especially with yoga. It puts together the time, the mind, body, emotion. Don't run out of time over here. So Reiki is another one of those great healing energy modalities that I've used, especially to break the addictions. This is a quote that talks about the difference between prayers and meditation. I think it really summarizes the place when it says that prayer is when you talk to God, meditation is when you listen to God. So we want to be careful with our thoughts because they have a certain vibration, as I mentioned. So eventually they'll become words, the words that become our actions becomes our habits, which then becomes the character, and it becomes your destiny, as Lao Tzu mentioned it. So here is some of the reference that I've used. Some of the books that are available that this information is being pulled out from. And one of the things that it's really important, and we talked yesterday, some of the guest speakers talked about heart-to-heart connections, is that we want to make sure that we connect having sure that people both. So physician once say the best medicine for humans is love. What happens if it doesn't work? So just increase the dose. Thank you.